Hey, good afternoon or good morning to everybody, depending upon where you are in the country. My name is Drew Shockley, and I'm with Move Health, and I am here to present on early retirement and some details on healthcare coverage for people in that pre-65 early retirement window. So, if you were trying to come to a webinar about health insurance options before 65, then you have made it to the right place. Joining me today is my good friend and head of marketing for us. Her name is Josie Living Good. Josie is going to be communicating with everybody in the chat. So if you are not familiar with Zoom, you should go down to the lower panel, and you should be able to find access to the chat. If you want to try it out, we'd love to have everybody put your location and where you are. So I am actually dialing in from the Move Health office here in Evansville, Indiana. Josie is from Dallas, Texas. Ken, hello from Denver, Colorado. Bev from Mesa, Arizona. Beautiful, but triple digits, I hear. So a little bit warm. Stay cool, Bev. Stay cool. We have, I believe, Tien from California. Welcome, Tien, and excited to welcome everybody. Lori from Florida, another Palm Desert, California. Jerry, welcome. We're thrilled that you all are here and that you take a little bit of time to learn about health insurance in pre-65 early retirement. So with that being said, we're going to just jump right in, dive right in, whatever you want to call it, and we're going to get going. So a couple things, during the presentation, we will have access to the chat. So if you have any questions, if you have things that you would like to discuss, or example, Josie has already put a question in the chat here. This is the best way to interact with us. If you don't realize or haven't realized it yet, I'm the only one that's on camera, so we can't see you. The only way we can interact with you is with the chat. And so we would encourage you to do so. It makes things a lot more fun or more engaging. Yes, Bev, actually, Josie will be providing that. Josie, I believe that we typically do recordings. And then we also make the recordings available. But Bev, we would recommend taking notes as well, if you would. Josie has a great question. She says, "Who are you rooting for in the FIFA World Cup?" I don't know. Me personally, my youngest son actually likes soccer a lot, so he's been watching a lot of the World Cup games. I can't, really name a lot of players that are playing in the FIFA World Cup, but I did see that Messi had a hat trick the other night, and I think USA won their first game. I'm not sure what happened after that, but Bev, you will see Josie's recording within 24 hours. So, Bev, you're getting a bit of an echo. Hopefully that's not the case. I do have, some noise removal type stuff and some other things going on here that should prevent that. But hopefully that is not the case for you. So we will go ahead and push forward. Welcome, Bev. Welcome, everybody. Again, please feel free to interact. So, as we're diving in here, let me tell you a little bit about Move Health. If you don't know anything about Move Health, we are founded by a team of insurance industry experts. If you look at our existing founding team, we have over 100 years of experience in the health insurance and Medicare space. We've built the very first SOC 2 Type 2 secure platform that works with financial advisors and their clients to help them do health insurance and Medicare planning. We focus on the pre-65 health insurance market. So that's people that are logging, that leaving a job and going to buy individual insurance, people that are retiring and needing to buy their own individual coverage. We focus on Medicare. We do Medicare supplements, Part D prescription plans, these types of things, dental, vision, and more. We are proud to say, and through our amazing team, it's not just myself and Josie, but our platform has been a wealthy award-winning platform. We've been featured in a number of publications. Josie is responsible for a lot of those features on the marketing side. And most recently, it's something we're super proud of is we were named a 2026 T3 Technology Tools for Today Software All-Star. We were rated the highest amongst other companies in our category, 8.39 out of 10. And we also have the most market share, over 41% market share in the financial advisor space. Everybody, Bev is back. Bev, so happy. I'm glad to know you're back. So a little bit about me. This is me. This is my family. This is my wife, Jessica, my boys, Mason and Max. We are into a number of things. Again, my youngest loves soccer. We play a lot of golf at the high school level, competitive level, and we love going to the lake and hanging out on the boat. But I've been in the insurance industry for over 20 years. I started as a sales assistant for Anthem Blue Cross Blue Shield in 2005. This is all like pre-Affordable Care Act, Obamacare, pre all the rules and laws that we have going on today. And I've been very fortunate and blessed to been a part of three successful startups, with the first one beginning in 2008. And so I've been in this industry for quite some time, and I'm really super passionate about what we're building here at Move Health. And I really do believe that we're doing a lot of good things to help people in this window. So we're going to have three key learnings for you today, and I think Bev is taking notes. So Bev, this would be the time when you would want to get out your pen and paper or however it is you're taking notes, and we're going to dive into key learning number one. Okay, I'm going to teach you about some pre-65 health insurance basics and go through the options in key learning number one. So how do people buy healthcare insurance today? If you look at the US healthcare system, here in the United States, we have about 330 million people that live in the United States. And more than 50% of people in the US, okay, so 330 million people, more than 50% of people have healthcare coverage through their employer, okay? Probably not surprising for most of you, but 50% of the population has group health insurance through an employer. They could be either like an active employee, a spouse, a dependent, or maybe a former employee. And, when you have health care coverage through a job, you don't really think about it very much, right? You just kind of, the annual enrollment period comes around, you kind of pick plan number one or plan number two, you just do this or that. And it's pretty turnkey. And that's how the vast majority of people buy health or access health insurance coverage today. 20% of the population is actually covered by Medicaid or state low income programs. Okay. You're probably familiar with this. A lot of times, whether it might be kids or children, or it could be adults, in many cases, there's specific rules around like pregnant females and other situations where people would be eligible for state low income Medicaid programs. But we have over 20% of the population that is covered by state low income programs. Okay. So 50%, 20%, moving on. 15%, 15% is actually covered through Medicare. Okay. Medicare is the federal program for those that are age 65 and older, or people that have become disabled, right? Sometimes you can be on Medicare earlier than 65. But this is roughly 15% of the population today. What we do at Move Health, we help people enroll in Medicare supplements, drug plans, Medicare Advantage plans, or other supplemental type products, dental, vision, et cetera, in the Medicare space. Okay, moving on. So we got 50, 20%, 15, and then 8%. 8% of the population have no healthcare coverage whatsoever. No healthcare coverage at all, which is crazy. We've been talking about this for quite some time, but this is roughly, 30 million people or so, or a little bit more, somewhere between 30 and 40 million people that don't have healthcare coverage at all. So we've got 50% through their job, 20% on Medicaid, 15%, 15 on the Medicare program, 8% that have no healthcare coverage. Who does that leave us with? Well, it leaves us with about 25 million people that are in the individual market. Okay. These are people that buy their own healthcare coverage. They buy their own plan on their own. Could be somebody who's self-employed. Could be somebody that works at a small company. Maybe they're a student. Maybe they do part-time stuff, or they're gig workers. Or my favorite person in this particular category would be early retirees. So people that are quitting their job moving into this individual market segment. So whenever you're doing that, or if you're considering that today, or you joined the webinar because you want to quit your job and you want to move on, let's talk about the options that are available in the individual market for people in this particular situation. Generally, there's roughly 4 options that somebody can consider in the individual market. Okay. A common approach or a common option that people would say is that they would utilize COBRA. I had somebody tell me over the weekend that their retirement plan was to get to age 63 and a half so that they could take COBRA for 18 months and then get to Medicare at 65. Now, me as a health insurance advisor and a founder of Move Health, I don't love that strategy. I don't like it at all because it doesn't have to be that way. But COBRA is an option that's been around for a long, long time. COBRA is actually not an insurance company, but it's a law. It stands for Consolidated Omnibus Budget Reconciliation Act of 1985. And it does have some pros. I mean, first of all, it's a continuation of the same healthcare coverage plan that you had through your job. Okay. If you have already met some of your deductible or have had some out-of-pocket expenses, your deductibles and stuff, out-of-pocket would carry forward if you're leaving mid-year. There's no change from your employer plan, right? So if you have Blue Cross Blue Shield of Texas, you would still have the same plan for the duration of the COBRA term, right? So if it was 18 months or whatever it was, you could keep the same plan. And a lot of times people are like, I'll just do COBRA because, I'm familiar with it, or I know how it works. I know what it is. So COBRA has some pros, but it also has some cons. Generally COBRA is the most expensive. It typically only lasts 18 months. And, if you're Medicare eligible, it is not credible coverage for Medicare. And so, what we would say is that, COBRA should be rarely used, or I would say, only a single digit percentage of the time should someone be utilizing COBRA. Bev, I see your note there. Thank you for sharing that. It doesn't always the case. It depends on the contract of the employer and how they are. So, I hate to hear that, but I'm glad you questioned it and glad you, tried to push forward. But it seems like probably due with the employer and the contract that you had and your transition and all those things, it didn't work like you expected. But so COBRA, again, should be rarely used. We think it should be used a single digit percentage of the time, and that most of the time you should be moving into other product options. COBRA is an option, but it's one of 4. Okay. Next, the way that some people choose to go in some states is looking at short-term medical plans. So short-term medical plans are not available in every state, but they are available in a number of states. This is typically a good option for somebody that's pretty healthy and doesn't have a lot of pre-existing conditions going on, somebody that wants a large network. Generally, you can get PPO type plans in the short-term world. Often short-term medical plans are lower cost than what you might find on the marketplace or from an Obamacare type plan. We'll talk about that in a second. But generally, you can get short-term medical plans whenever you want. There's no special enrollment period needed. They do have some downfalls, though. So most of them are not ACA compliant, which means they don't cover pre-existing conditions. They don't cover pregnancy or prescription drugs, things like that. Most of them are still medically underwritten, meaning they have like a height and weight guideline and they have, different things. And you can be turned down for short-term medical plans. And then also dependent upon where you live, you may be only able to get a short-term medical plan for, say, 90 days, or in some cases, even shorter. So short-term is an option, but when you look at the individual market, it is used by fewer than 1 million Americans. Okay, so of the 25 million people that are buying coverage in the individual market, less than 1 million are on a short-term medical plan. Okay, COBRA, short-term medical. What's the next one? Next one, healthcare sharing programs. Okay. You're probably here and you're like, I've heard about healthcare sharing programs. I don't really know much. I would love to learn more. Well, good. I'm going to spend one slide on it. We love healthcare sharing programs, and they're a great non-insurance alternative for individuals and families that are looking to do something different than like a full Affordable Care Act style plan. And so they have a lot of benefits, right? So first of all, generally they are often half of the cost of an unsubsidized marketplace plan. They typically have very large or even no networks, and you can get healthcare sharing programs at any time. But they do have some downfalls. They may or may not be ACA compliant. Most of them are. There's really no guarantees that they're going to pay for certain things since it's not insurance. And then you have to be really, really careful in the healthcare sharing world because there are a lot of smaller healthcare sharing programs that may fizzle out or become insolvent because they're super, super small. Now, here at Move Health, we work with the largest faith-based healthcare sharing program. It's called MediShare. That's actually what I do personally for my family. So we're very comfortable with healthcare sharing programs. We're very comfortable with how they function and how they operate. If it is the right thing for you, our agents, and advisors that you're working with will tell you, and they will direct you in the right path. If it's not the right path for you, we will also tell you. But roughly around 2 million Americans are enrolled in a healthcare sharing type program, and it's an option that we consider. Now, last but certainly not least is what the vast majority of people do in the individual market segment. And that is the Affordable Care Act marketplace style plans. Okay. You may know this as marketplace or ACA plans or Affordable Care Act plans, or often still called even, 12 years later, Obamacare, right? This is roughly used by about 92%. 92% of the individual market are enrolled in some form of an Affordable Care Act style plan. What are some of the benefits? Well, first of all, they're required to cover pre-existing conditions right away. Pretty much everybody knows that, but you might be surprised people that don't. But they immediately cover pre-existing conditions. So it doesn't matter what's going on health-wise, cancer, heart attack, stroke. You could need to have a hip replacement, knee replacement, shoulder replacement, organ transplant, whatever. You are guaranteed issue into individual Affordable Care Act compliant plans, no questions asked. Okay. The only thing they ask you is where you are, like where you live by state, and whether you use tobacco or not, and what your age is. So every 62-year-old person that lives in, Dallas, Texas, or, Mesa, Arizona, or Nashville, Tennessee, or Atlanta, Georgia, every person in that particular region or state pays the same exact cost for their healthcare plan. It doesn't matter whether you are a marathon runner or you're not in too good of shape. Okay. They all pay the same because just based on your age, where you live, and smoking status. Oftentimes, people that are in the individual market segment, if you're looking at an Affordable Care Act compliant plan, you're able to use a federal tax credit or the subsidies. And that many, many times makes the Affordable Care Act style plans the most affordable option by far. In many cases, it's not even a question. And this allows for a strategy to manage your modified adjusted gross income and help to lower the cost of your ACA style plan by working with a financial advisor or working with an accountant and reducing your income in these early retirement years. We're going to talk a lot about that today. Okay. But what are some of the issues? Well, first of all, many of the Affordable Care Act plans have restrictive doctor networks. Okay. So you might find HMO, HMO POS, or maybe an EPO. You don't find PPOs all that often. Some states have them, but many states do not. So that's an issue that some people run into. If you're dealing with it for the first time, people are, it takes a couple extra steps whenever you do your federal tax return. You have to prove your income. You have to show, your eligibility for premium tax credits, and then you have to do kind of a reconciliation each year. It's not really that big of a deal, but if it's the first time doing it, it requires a little bit of extra legwork. And then in many cases, these plans that people are coming into and looking at from an Affordable Care Act perspective, sometimes they have higher out-of-pocket cost when compared to a group health insurance option or a previous employer style plan. And so when we look at the options of people that are moving from group into the individual market, COBRA, short-term, healthcare sharing programs, and Affordable Care Act compliant plans are what the vast majority of people do. So let's dive in just a little bit more on ACA before we move on from key learning number one. So I mentioned it earlier, but Affordable Care Act plans are guaranteed issue. This has been the case. The Affordable Care Act passed in 2010, and all plans that were purchased on or after January 1, 2014 are guaranteed issue. You can't be denied insurance because of a pre-existing condition. Rates are impacted just based on where you live, location, and tobacco use, and coverage is available. You're not getting coverage from the government. You're getting coverage from the Affordable Care Act marketplace where the insurance carriers put their plans. And so, it is, it's something that, we have been dealing with since the very, very beginning. Sometimes it's very new to people. And so I really want to dive in and talk a lot more about the advanced premium tax credits and how to make health coverage affordable in this early retirement window. Okay, so we're going to move on to key learning number 2. And this is going to be a deep dive on advanced premium tax credits. Now, if you're a financial advisor and you're here, you're watching this recording, or you are on today's webinar today live, I apologize if this is offending to you, but many times when we work with financial advisors, many financial advisors do not know about the advanced premium tax credits or the details of advanced premium tax credits and how to leverage the advanced premium tax credit. So we like to educate. We like to partner with financial advisors. They're the best. They're super smart and genius in a number of areas. But from a healthcare perspective, this is an area that a lot of financial advisors miss out on. And unfortunately, it causes a lot of people to stay working in their jobs because they don't know how to leverage these premium credits. So we're going to talk about them. We're going to teach you all a little bit today. So what are they? Well, the purpose was designed under the Affordable Care Act to make healthcare coverage more affordable when people are purchasing plans on the marketplace. The key word is advanced. Okay, so you're getting these tax credits in advance. You don't have to wait until you file your return, or you don't get like a lump sum later. You can get them in advance and you get the reduction right away. Why are they out there? Well, a lot of people couldn't afford private insurance before the Affordable Care Act. And so these credits were designed to offset the cost of a plan, encourage more healthy people to get kind of into the risk pool, and reduce the number of uninsured, Americans. And so, how do we do it? Well, we're kind of all paying for it. It's funded through the federal tax credit, system. And so we're all paying for it, whether you're using them or not. And so if you're in a situation where you can use them, you should definitely do so. So how do they work? Well, basically you come to a certified agent like Move Health. You sign up for healthcare coverage. You make an estimate to what your household income is going to be for that particular year. The marketplace would spit out an expected premium contribution based on your income and where it is. The lower your income is, the more tax credit you would get. The higher it is, your tax credit would be reduced, or in some cases, it would even go away. The government sends that money directly to the insurance company, and it's applied to your monthly premiums in real time. At the end of that year, you would reconcile your premium credit based on the income you projected and the income that you actually ended up making. So this is super important. Whenever you make a projection of your income, you have to reconcile it on your federal return at the end of that particular tax year. So people that are in 2026 right now, they would do the reconciliation in April of 2027 for what they projected their income to be and what they actually made. Okay. This has nothing to do with any previous year's income. It is not related to the IRMA increase, which is on the Medicare side. IRMA is a 2-year look back. The advanced premium tax credit is current year or future year, or whatever year you're getting the healthcare coverage for. That's what it is. So it has nothing to do with assets, nothing to do with the value of your home, your investment accounts. It is actually your modified adjusted gross income for the current year. So who can actually take advantage of the premium tax credits? Well, it's pretty simple. You cannot be eligible for healthcare coverage through employer. You can't be eligible for Medicare, and you can't be eligible for Medicaid. Okay, so you can't be on a coverage through a job, Medicare, Medicaid. That actually knocks out like 85% of the population. Okay, most everybody. You have to enroll through the federal marketplace. You have to maintain an income within a certain threshold. That acronym up there, FPL, is federal poverty level. And so you're probably saying, hey, well, what is the federal poverty level and how does that work? Well, I'm going to help you understand that. And so just for some clarification and kind of from a timeline perspective, we've been dealing with the Affordable Care Act premium tax credits since 2014. This is not new. Okay. So these were introduced when, the President Obama had passed a law, March 23rd, 2010, took an effect in waves. with the largest one of those waves being the marketplace in 2014. This is when tax credits started, 2014. We've had some changes over the years where actually in 2021, the American Rescue Plan was passed, and the limit or the income limit was actually removed. So we had a period of 5 years where you could make a much higher income and still get tax credits. And then at the end of 2025, we actually came back to the original rule under the Obama administration, where the 400% of the FPL was reintroduced or brought back in. So what does that look like today? Well, if you look at this particular chart, and I'm going to use my little drawing tool. I think Josie loves when I do this. If you look over here on this side, you actually have, let me get that out of the way. You actually have the number of persons in a household, and then you have options 1, 2, 3, 4. That's not the number of people that live there, but this is actually how you actually file your federal tax return. So you have to be a legal dependent, a child or a spouse or whatever. It has to be how you legally file your tax return. And then you'll see this sliding scale here from 100% all the way to 400% of the FPL. So today we're living in a world where a single person can only take advantage of the tax credits if they're at or below roughly $62,000, dollars. A household of two is roughly $84,600 in modified adjusted gross income. Now, we did not deal with this between 2022 and 2025. You could make well above this and still get the advanced premium tax credit, but that is not where we stand today. Okay. Today, we are still in a world where you have to make at or below 400% of the FPL, and the numbers here are as they are set forth. Okay. So if you're trying to move into the individual market, these are some key terms for you. These are some key things you should understand. Modified adjusted gross income, which is essentially your AGI or adjusted gross income. And they need to be based on your household size. So based on the number of, spouse or dependent, whether you're married or have, dependents or whatever. And then all income would be attributed to that MAGI minus your deductions to get you to the point of what AGI would be. So most people are trying to live within this threshold if they're single or married. $84,600 if you're married, that's the number. It doesn't matter what your investment account balance is. You could be a multimillionaire, have multiple homes. You just need to work with your advisor and get your income down below $84,600 if you want to take advantage of the advanced premium tax credits. Okay. So what does it look like in a real live case study? Okay. We're going to do that. And we're going to go to Nashville, Tennessee, which is my home state. I'm actually from Tennessee, which is why why I like going there. But this is Nashville, Tennessee. And this is an early retiree couple, 62 years old up here at the top, 62-year-old male, 62-year-old female in Nashville, Tennessee. This is actually a screenshot from the Move Health platform, giving you an analysis on what healthcare costs would be in each of the metal levels for this particular example here. I have put in their income at $250,000, intentionally showing what their cost of healthcare coverage would be if they're above the Affordable Care Act premium tax credit threshold. Okay. So it's estimating, and some of you that have probably seen this, you would get a price for your healthcare coverage, and it would be somewhere in the neighborhood of, $30,000 a year, right? $2,400 a month puts you, somewhere $29,556. Most of you would take a look at this and you would say, hey, that's not that exciting. I'll just keep working at my job where I pay for my insurance, and I'll do that until I'm 100 years old or whatever. That's not too exciting. We love helping people quit their job and move into the next phase of their life. So what does that look like? Well, it's important to note, if we'll go back to the threshold here, what would it look like if they were able to get their income at or below $84,600? Well, I'm going to show you. This is the current estimate if their income is above the threshold. Here's the estimate if they were able to get their modified adjusted gross income to $84,000. Okay. Same early retiree couple, showing you the power of advanced premium tax credits. Now, in this particular situation, that $84,000 modified adjusted gross income would be worth $1,900 a month in premium tax credits. When we're talking about the premium credits, we're not talking about like dollars here. In many, many cases, we're talking about tens of thousands of dollars on an annual basis. Okay. In this scenario, it's $22,956 a year. Okay. I'm from Tennessee, so my math is not great. So I'm going to use my calculator. $22,956. If you had an early retiree couple that quit at 60 and they did this for 5 years, this could make over a $100,000 difference in your healthcare costs just because you know what the income levels are and how to leverage the advanced premium tax credits. So don't retire without it. You have to. This is showing you the power of advanced premium tax credits and how much it's worth to you. Okay. So you may be sitting here and you're like, all right, I'm pretty sure I could do this. I think I could do this. I have, these money here, this money, cash reserves. I got my 401k. I can probably roll that over. I can do this, this, and this. And your wheels are already spinning. Okay. So we're going to give you some key learnings here to say, hey, how would I actually do this? When would I do it? How do I do it? What are my action items? And what's my next step if I want to, start working toward this way? So first of all, here are some enrollment timelines that you need to be aware of. First of all, if you are looking for ACA plans and COBRA, you must have a qualifying life event, like leaving your job. Like you leave your job, that's a qualifying life event. A death would be qualifying, divorce, or maybe a kid that's aging off the policy. Here's an example: a kid that's 26 years old, they're losing coverage through a job. That would be a special enrollment period. In this world, that's when you could buy Affordable Care Act compliant plans if you have a special enrollment period. If you're looking for healthcare sharing or short-term medical, you can do that anytime. But generally, you need to do this within a 30 to 60-day window whenever you do this. Now, if you're not in that period, or you don't have an SEP or a special enrollment period, or you're on COBRA today and you just started it and you have another year of COBRA, then you would have to act in the standard open enrollment period, which is every fall. This time period runs from November 1st through December the 15th of every year. And that's when you can move in to the Affordable Care Act, marketplace type plan. Who should be reviewing their coverage during open enrollment? Well, everybody. Maybe you're already out there and you're already on an Affordable Care Act compliant plan. And you're like, hey, well, I have this plan with this carrier, but I don't really like it. Well, everybody should be reviewing their healthcare coverage during this period. So pre-65 retirees, small business owners, somebody who's responsible for buying their own healthcare coverage, people that are on COBRA, people that have had any recent life changes, so health medication, where you live, people that want to move into a health savings account, people looking to optimize coverage, or anybody that wants to leverage the advanced premium tax credit. Maybe you said, hey, I'm on a marketplace plan now and I'm not using the credits. What happened? What do I need to do? Well, this is when you would need to do it. Somebody that's looking to leverage advanced premium tax credits, you would do it during this period, November 1 through December the 15th. We have many people that pull forward income into earlier tax years or current tax years so that they can reduce their income in future tax years and leverage the advanced premium tax credits in a high level. So there's so much to it. It's all, very, very tailored to an individual basis. And we would recommend, for anybody that's out here ready to take the next step, here's what you should be doing. Contact your financial advisor and have them initiate a relationship with Move Health or initiate a health planning analysis. So if your advisor is already working with us, then this is what we can do. They can go in, they can initiate a healthcare planning analysis. This is a picture of our platform showing how to do it. During this time, we would review provider networks, HSA eligibility, drug coverage, doctors, gold, silver, bronze level plans, all of these things. We would look at carrier stability, drug costs, and all these things. And we would do this in the individual market for clients that we're working with from financial advisors on a regular basis. We do this exact same thing in the Medicare space as well. So if you're here and you're approaching 65, or you have a spouse, that is turning 65, you would need to do that. So Tien, great question. Tien says, if nothing needs to be changed, do you need to enroll each year. And so we're going to move into kind of a Q&A type moment, to kind of a Q&A type question. So I'm going to invite everybody to put their questions here, or you can use the Q&A bot as well. I know that Josie will be watching that. I don't see anything in there at the moment, but Tian's great. You can put your question just in the regular chat. So Affordable Care Act compliant plans only last 365 days in total term. So even if nothing has changed, your healthcare plan is going to change. No plan lasts longer than January 1 through December 31st. Every carrier changes their plan, changes their benefits, changes everything on a calendar year basis. So you have to be really careful with that, TN. Whenever you're doing it, even if nothing's changed, you really need to evaluate, and you need to make sure that you're making a good decision for the next year. So Ken, great question. Do we need to work through a CFP, or can we work directly with Move Health? So Ken, great question. Our preferred method is to work in conjunction with a financial advisor. However, there is a way to connect with us individually. You can go to movehealth.io, and you could invite and start an engagement with us there directly. But most often, we're probably going to try to engage a financial advisor to help, especially if we're trying to leverage advanced premium tax credit. Jerry, great question. Jerry, what is carrier stability? Well, Jerry, it's a great question. If you just pulled up your computer or iPad or whatever, and you did a little Google right now, the Affordable Care Act marketplace has a lot of changes. There's a big company that starts with the letter A and ends with Aetna that is departing 17 states in 2027. Okay. So we help clients evaluate carrier stability, whether they're going to be in the marketplace next year or not, what their history is from a claims perspective, what they're doing from a market perspective, where they're competitive, where they're not competitive. And so we have that knowledge because we're working in this space every single day and have been doing it for a long, long time. So this is a very, very important element that you should care about, and you should make sure that you're choosing a carrier that's going to be strong for you in the period of your early retirement years, whatever that may be. So great question, Jerry. Invite other questions. We do have time. We do have time for more questions. Feel free, there you go, Jerry. So Aetna, let me just clarify. Aetna is going to continue offering group insurance, and they're going to continue offering any type of employer type plans. They're actually going to continue in the Medicare space, but they are not going to be offering individual ACA compliant plans. Bev, Move Health is not part of Empower. Move Health is an independently owned, privately held company. I'm one of the founders. We have two other founders. I'm not, when you say Empower, I'm not overly familiar with what you mean by that. But we are not part of Empower. If you're talking about the financial services company, the financial advisor groups, we do work with a number of financial advisors and several thousand advisors over the country, but we are not, we are not a subsidiary of Empower. We're not owned by Empower in any way, shape, or form. So Move Health is an independently owned company, privately held, by myself and two other founders. Great question. Other questions? I invite you. You can use the notes, webinar chat, whatever you'd like to do. Josie said earlier that a recording will be going out typically within 24 hours, gives it time to go through, get it. We typically have it out, before then, but, Bev says, can my CFP and Empower that manages our IRA connect with us and to begin the process? Absolutely. Bev, we would invite your advisor to do that. They can go to movehealth.io, which is our website. You can click on that link, pull it up. It's really easy to engage with us, work with us. So if you, I'll just show you this screen here real quick. So you can go to movehealth.io. You can click whether you're a financial advisor or a client. So if you want to go and click your financial advisor, you can go here. This is where they can get started and work with us, look at all of our resources, et cetera. And we would invite, your advisor to be able to do that, and you as well. Tien, when should work with the Move Health if I want to start ACA in 2027? Great question, Tien. We'd love to work with you. We are booking meetings already for the month of November. So if you're looking for 2027 healthcare plans, and depending upon where you live, in most cases, we wouldn't be able to do anything until November 1st. I think you're in California, so we'd use the Covered California Marketplace there, and we would need to do that in early November. And we'd love to connect with you. Invite you to go to movehealth.io. You can click on the client link, and you can work with us there. Great, Tim. Great question. All right. So we're kind of nearing our time. I want to thank everybody for being a part of today's webinar to learn about the things that we have going on. If you do visit our website, movehealth.io, you can see a number of our case studies, different things that we have going on. This is one of my favorite things that Josie has put together here. This is the retirement green light. This is talking about healthcare planning and how this particular financial advisor was able to unlock retirement for our clients. And so we invite you to go to movehealth.io. Let's see. Looks like Jerry, sorry, I missed it. So if I go to the ACA marketplace, it's possible that I could sign up for healthcare and miss signing up for the advanced premium tax credit. Jerry, that's right. And that is something, unfortunately, that does happen. And people do miss out on that. And so, yes, Move Health would help you go to the marketplace, help you determine what your modified adjusted gross income would be, generally in conjunction with an advisor. And we would make sure that you actually access the advanced premium tax credit and leverage every dollar that's made available to you. And so, yes, that is what we do. And we'd love to do that with you and with your family as well. So great question. Elliot has a great question. So if I am in an SEP, so a special enrollment period, and I need help, is there a place where I can engage with you for a discovery call? Elliot, you can go to movehealth.io. You can choose I'm a client and click to meet with us, at your convenience. There's a way to engage with us to book a discovery call. So I invite you to go to movehealth.io, click I'm a client, and you can find the book a call with us. Bev, great question. So to clarify, I can myself go to your website, get some cost estimates while I wait to have a CFP involved. Yes, Bev, we invite you as well to go to movehealth.io, click I'm a client, and go ahead and book a discovery call with our team. And we would love to engage with you in that way. If you do have an advisor that you're working with on a regular basis, we probably will try to coordinate that, because income planning is such an impact on healthcare cost. And so, we'd love to work in conjunction. We don't do any competing services with a financial advisor, CFP, or whatever that might be. We are offering complementary services, healthcare planning and Medicare planning, to what a financial advisor was due, and helping to unlock this transition for clients that are in this window. Great question. So this recording will be sent out to everybody in the next little bit. Everybody will have access to that, the slides. If you took great notes, great. We'd love to invite you to go to movehealth.io and spend some time getting to know us. Thank you, Bev. Thank you, Jerry. Thank you, DJ. Thanks to everybody that was here. Elliot, absolutely happy to do it. We're so great to meet you all, and excited to get a chance to work with you at some point. Jerry, I'm glad you learned something. Look forward to connecting with you again. Thanks, everybody. Hope you have a good rest of your Thursday.